Hello and welcome to Thing of the Month. Join us as we take you behind the scenes of Barts Health Archives and Museums to reveal highlights from our collections. Today, we're looking at the story behind these trays of strange-looking stones which can be seen on display at the Royal London Hospital Museum. These are urinary calculi, hard masses of uric acid and mineral salts which form in the urinary tract, mainly the bladder. The calculi in these trays are mostly bladder stones extracted from patients at the London Hospital between 1874 and 1890. Stones are usually caused by the retention of urine in the bladder, which crystallises and then hardens, but in the past a poor diet could also be the cause, particularly in children. As you can see, stones can vary widely in appearance and size, from the tiniest fragments to the size of the whole bladder. Before the 1600s, one stone was removed at La Charité Hospital in Paris which weighed over 50 ounces, or 1.5 kilos. Stones were removed by an operation called a lithotomy. These operations date back to the earliest times and were often brutal, not to mention painful and dangerous. In the 4th century BC, Hippocrates urged his followers not to cut the patient to remove the stones, as this could kill rather than cure. Over the centuries, an array of different techniques and instruments were developed for the procedure, whether cutting or manoeuvring the stone out of the patient's body or crushing it inside the body to enable the fragments to be passed naturally. However, lasting injury and mortality remained high, not helped by the number of travelling lithotomists who had little knowledge of anatomy. We have a number of lithotomy instruments in our collections, such as this scoop for the removal of bladder stones, dated around 1880 from the London Hospital, and these instruments called lithotrites for crushing stones in the bladder, dated from around 1827 from St Bartholomew's Hospital. Famously, the diarist Samuel Pepys underwent a lithotomy, having suffered from bladder and kidney stones since childhood. On the 16th of March 1658, a stone the size of a billiard ball was removed from Pepys's bladder. The operation was performed by Thomas Hollier, a skilled surgeon who worked as a so-called stone cutter at St Bartholomew's and St Thomas's hospitals. Despite the ordeal of enduring the procedure without anaesthetic or antisepsis, Pepys was so grateful to have his stone removed and to have survived the operation that he gave a celebratory dinner or stone feast every year and kept his stone in a specially made case. Other notable historical figures to have suffered from bladder stones are Queen Caroline, wife of King George II, Peter the Great, Oliver Cromwell, Isaac Newton, and the physician William Harvey. Nowadays, the most common procedure to remove bladder stones is a cystolitholipaxy, where a thin tube or cytoscope with a camera at the end is used to find the bladder stones. Stone crushing devices, lasers or ultrasound are then used to break up the stones before they are removed. So, while we don't know the identities of the patients from whom these stones were extracted at the London Hospital, we can certainly sympathise with what they endured. We hope you've enjoyed this video. We'd like to hear about your favourite item in the collections. You can search our online catalogue via the link below and follow us on Twitter and Instagram to tell us what you find.